Hi guys, I hope you're fine and welcome back to my channel. In this video, we are going to discuss about the glossopharyngeal nerve, which is ninth cranial nerve, and let's talk about its anatomy and examination. Let us start with the discussion of anatomy of the glossopharyngeal nerve. So as you know that the glossopharyngeal nerve is a mixed type of nerve, it means that it has two parts, the motor part and the sensory part. So now the motor part arises from the nucleus ambiguous that is present in the medulla oblongata, and then it leaves the skull through the jugular foramen, along with 10th and 11th cranial nerve. And then this glossopharyngeal nerve supplies the stylopharyngeus muscle. We will discuss about the action of the stylopharyngeus muscle later on in the examination part of the glossopharyngeal nerve. Now let's talk about the sensory part of the glossopharyngeal nerve. So the sensory part carries the sensation from the pharynx, soft palate, tonsillar region, posterior one-third of tongue, tympanic cavity, and Eustachian tube. It also carries the taste sensation from the posterior one-third of the tongue. And then the last part of the glossopharyngeal nerve is the parasympathetic or the secretomotor fibers. These fibers innervate parotid gland and control salivation. Now let's talk about the examination of glossopharyngeal nerve. So now let's start with the motor part of the glossopharyngeal nerve. So as you know that the motor part of the glossopharyngeal nerve supplies the stylopharyngeus muscle, and stylopharyngeus muscle's action is that it elevates the pharynx and the larynx, and it also dilates the pharynx. It means that the stylopharyngeus muscle facilitates in swallowing as well as it controls the quality of the voice. So now we are going to perform some tests in order to look for the swallowing and the quality of the voice of the patient. So now in the first test, we are going to evaluate the swallowing of the patient. So here we can command the patient to take the sip out of water so that we can look for the sipping or the swallowing, that is the action of the stylopharyngeus muscle. Now, if the patient feels any discomfort or difficulty in swallowing or sipping, then this is referred to as dysphagia. Now, our next test is to evaluate for any deviation that is present in the uvula or in the tonsillar arches. And for this, we are going to command the patient to open his or her mouth wide, and then we are going to expose the light inside the mouth of the patient so that we can see any deviation. If there is any kind of deviation in the uvula or in the tonsillar arches, that would be towards the normal side or the stronger side. Why? Because on the normal side, the muscles are going to elevate the soft palate of that side, while on the weaker side, the soft palate is going to be hanged loosely. In this way, the deviation in the uvula would be seen towards the stronger side, or which is the normal side. Now we are going to evaluate the quality of the voice, and for this, we are going to ask the patient a few questions, like what's your name or what problem are you presenting with. The abnormal sign is when the patient has the hoarseness in the voice. This is referred to as dysphonia. Then we will evaluate the cough, and for this we are going to command the patient, please can you cough for me. Now in the patients who have the glossopharyngeal nerve damage, they are unable to produce the explosive type of cough, because in these patients the glottis is going to be elevated a bit. In this way, they cannot produce the explosive type of cough. Rather, these patients would exhibit the non-explosive cough, or which is also referred to as a bovine cough. Now let's evaluate the sensory part of the glossopharyngeal nerve. So as you know that the glossopharyngeal nerve carries the sensation from the pharynx, from the soft palate, and different other regions that are surrounding it. So in order to test for the sensory part of the glossopharyngeal nerve, we have two types of test. One is the gag reflex or the pharyngeal reflex, and the other is the parietal reflex. Now, in order to perform the gag reflex, simply command the patient to open his or her mouth wide and then take a cotton swab and touch the area of the pharynx. You can either touch the posterior pharyngeal wall or the back of the tongue in order to elicit the gag reflex. And during the gag reflex, you are also noticing any kind of deviation in the uvula or in the tonsillar arches. Now let's discuss about the pathway of the gag reflex. Now the gag reflex has two loops, the sensory loop and the motor loop. The sensory loop is initiated when there is the soft palate stimulus by the tongue depressor, the sensation of which is carried via the glossopharyngeal nerve to the brainstem, and specifically to the two nuclei, the nucleus tractus solitarius and the spinal trigeminal nucleus. Now, the nucleus ambiguus in turn stimulates the two type of nuclei, the motor trigeminal nucleus and the hypoglossal nucleus. The motor trigeminal nucleus stimulates the third part of the trigeminal nerve and causes the jaw opening, that is by the mandibular depression and protrusion. Then the hypoglossal nucleus stimulates the hypoglossal nerve, which in turn performs this action, that is the tongue thrust. Now let's talk about another type of reflex, that is a palatal reflex. And it is exactly the same as that of the gag reflex or the pharyngeal reflex. It means the pathway is same and every other thing is same. Only the difference is that the cotton swab is touched on the soft palate rather than on the pharynx. Now let's talk about the evaluation of the parasympathetic fibers of the glossopharyngeal nerve. So as you know, the parasympathetic fibers, they supply the parotid gland that controls the salivation. Now there is no specific test for it, but the patient can himself report that he feels the dryness in the mouth, which signifies reduced or decreased salivation. So alright guys, that's all about the glossopharyngeal nerve, and I hope you learned something from this video. Thanks for watching.